from memory of the four-way test of the things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, build goodwill, better friendships. Fourth, will it be beneficial to all concerned? So welcome. We usually do tech tips and stuff. I'm just going to call out, be sure and be mindful of your mute and unmute. You know, mute for most of the presentation if you're speaking, unmute, and then remember to, you know, we're all practicing, so be patient with all of us. So we have a little bit of a status update. We did quite a bit of that in our pre-meeting, but is there anything to bring forward in terms of how your Rotary clubs are staying in contact with each other, and any new ideas on how to get in touch with you, keep your clubs together?
The Sioux City Club is going to do a virtual happy hour. I know that's not a new in terms of strategy, but we were a little slow in terms of a weekly Zoom meeting, and that's been up and running for about 3 weeks now. And so now we're going to try the virtual happy hour. So we'll see. We've had good attendance at the meetings, so the thought is that people will want to maybe get together and socialize a bit too.
Yeah, I've heard others that's worked out really well. So let us know how it goes.
Have been kind of unresponsive, and so I don't know really where other folks are at.
Okay. And once again, we've the pre-meeting, we've had quite a bit of ideas about COVID and how it's impacting the community and the needs, and what's anything to bring forward to the formal meeting, or people that have just joined? I would mention again that we have already 7 applications for our pop-up grant for clubs to respond to needs in their community or in communities near them that don't have a Rotary Club. I know that Area 7 is going to put one together for Crofton, Nebraska, where we don't have a Rotary Club. And that's one of my sweet spots, is that's where I'm from. That's where I came from before I moved to South Dakota, was Northeast Nebraska. And with the closing of the South Sioux City Club a few years ago, we don't have a strong presence in Northeast Nebraska. And Northeast Nebraska is really vibrant in terms of humanitarian effort and philanthropy. So I think it would be a good place to have a Rotary Club or two. Food seems to be kind of the big thing. We're ready to go right to the program. I see Ann Lee's on. I wish I could show this photo to you. Got a couple of photos. I might do that anyway. Do the sharing thing again and as a way when I introduce her. So, moment. And so our presenter today is Ann Lee Hussey. Now, where are my notes? Okay. I've got so many papers on my desk, I am totally lost. I just put this together. Ann Lee is from South Berwick, Maine. She's a member of the Costco Bay Rotary Club. She joined Rotary in 2002. Ann Lee is a polio survivor. She's also led over 30 NID, which is National Immunization Day trips to places like India, Mali, Niger, Nigeria, Bangladesh, and even Pakistan. She served her club as president from 2005 to 2006, as district governor for her district in 2010 to 11. And she's held many service roles in Rotary. She's definitely a boots on the ground kind of a person. She believes one person can make a difference and that it is a privilege and a gift to do the work of Rotary. Please welcome my hero, Ann Lee Hussey. And Nicole, if you get me out of this. So Ann Lee, take it away.
Okay. Well, thank you for that nice introduction. It was really sweet. Welcome, all of you. It's really nice to be with all of you today, even if it's just virtually. I visited your great state once, and I certainly hope to come back again. I want to thank you, one, for being here, but I also want to thank you for your willingness to serve your clubs and to serve Rotary and to serve your communities. It's really important that people step forward, especially now during this time. Each of you play a major role in growing Rotary, not only in membership, but in creating awareness and expanding Rotary service activities. And we are certainly living in an uncertain time with COVID-19, and I wish all of you and your families to stay safe. I want to share with you today reasons why supporting Polio Plus during this time is so important, and that by supporting Polio Plus, you are also supporting the work of fighting COVID-19. The current coronavirus outbreak is very reminiscent of polio outbreaks that occurred across North America years ago. Some of us seem to have forgotten, but perhaps because many of us may be too young to recall. This particular outbreak made me think about the polio epidemics of the 30s, the 40s, and the 50s. People lived in fear. I'm just going to make sure my volume's up. People lived in fear of the polio virus as it spread through towns and cities across our nation. Children and adults were at risk, yes, even in the communities where you're living now. And people avoided public parks, playgrounds and swimming pools were closed, theaters were closed. Anywhere that large gatherings were held, you were told not to attend. And similar to this past Easter season, ministers, priests, rabbis had to use radio to connect with their parishioners. They didn't have the benefit of all the technology that we take for granted these days. Those parents who could afford to bundled their children up and left the cities in hopes that the more rural areas would offer them protection from the virus. But unfortunately, that did not always work. And it actually helped to spread the polio virus to the rural regions, such as where I live in Maine. We're actually seeing some of that again now with the COVID. I live close to Massachusetts, and they're coming up in groves because they usually come to Maine to vacation. And with it, they're bringing their outbreak. It's true back then that no one knew when polio would strike, who it would attack, or really how to stop it. And in reality, they really didn't even know how to treat the crippling effects of polio. They learned as they went. Some families were spared, others lost family members, and many had multiple family members affected, both children and parents. I don't recall this personally, but I know my parents felt the fear. And in the end, polio attacked one of their children, and that was me. During this outbreak in 1955, Boston was the center of one of the worst epidemics on the East Coast. Hospitals were overflowing. The sidewalks and the streets were full of vehicles bringing in polio victims. Triage took place on the sidewalks as best they could, and many people died. It was a challenging time. Fortunately, a vaccine came out that very same year in 1955 that started to halt the polio outbreaks across the country. And our medical facilities have improved over the years, and I, for one, am truly grateful for those who dedicate their lives to a medical profession. Today, I am able to walk with limitations, although I have residual damage in both legs with daily challenges that I face. I am extremely fortunate to be able to carry out rather normal activities and also to travel for Rotary. When I contracted polio, it was a time when local papers would list the names of folks who were sick. And my illness was in the Portland paper, and the Mrs. Woodbury of Brunswick, Maine read about me. She promptly sat down and she wrote a letter to my mom, and thus began a long relationship between the two, with me as the main topic. When I was old enough, I also began to write her letters. And when arthritis crippled Mrs. Woodbury's hands, she pecked out her letters to me on an old typewriter. Every time that I was in the hospital, I received a postcard daily from Mrs. Woodbury. And on every holiday, whatever the occasion, as well as on my birthday, she sent me a card. And in those cards, she always tucked $2. And that may not sound like a lot of money today, but I remember the first time I visited Mrs. Woodbury at her home. She and her husband lived simply and were not wealthy, not monetary wise. Mrs. Woodbury was rich in heart. Mrs. Woodbury continued to send me cards for 35 years until her death. She is my best example of what living in Maine is all about. My best example of small communities. More importantly, my best example of how people and communities pull together to offer support, even when they're separated by many miles. Mrs. Woodbury taught me the meaning of giving, and more importantly, the art of receiving. And unbeknownst to both of us, she helped to lay the foundation for me to join Rotary. So never ever underestimate the impact that you may have on one individual's life through an act of kindness. Remember, an ordinary life can be extraordinary, and that magic can be found in the everyday. And thus, these are a couple of the reasons why I became so deeply involved with polio eradication. Today, we are in frightening times as the coronavirus spreads in ways reminiscent of poliomyelitis. But it's instructive for all of us to remember what it's taken to nearly eradicate polio, and a reminder of what we can do when we're faced with a common enemy. Some similarities. Both COVID-19 and polio are caused by a virus. Not sure how to treat COVID-19, and we're learning as we go. COVID-19 appears to attack mostly the respiratory system, but also the blood system. It's transmitted via respiratory, but polio is also transmitted via droplets from sneeze and saliva, but it's primarily through the digestive system and the fecal oral contamination. Polio attacked primarily children, although many adults were affected in the early years. COVID-19 seems to be attacking older adults. Exceptions are seen with both. And excuse my dog. Both viruses have created fear. And at the time the polio outbreaks were happening, there also was no vaccine available, just like today. Dr. Howard Markle, who teaches the history of medicine at the University of Michigan, says that measures taken in the 1950s, like containment and closing schools, offer some hope for the way we're fighting COVID-19 today. His quote is that we can learn is that our predecessors have met those contagious crises with far less armaments and tools in their toolbox, he says, and they came through on the other end. And we can do this, and we will do this with COVID-19. Now, the COVID-19 emergency means that some aspects of our polio eradication program will definitely be affected. Polio campaigns have ceased during the COVID-19 outbreak. Because the majority of work is done house to house, campaigns have been halted to protect workers and to reduce the spread of coronavirus among the population. 5 years ago, if you recall, Ebola hit Africa, and governments responded with billions of dollars. Yet everyone, including the then heads of the World Health Organization and the CDC, later agreed that it was the polio workers who were there in the villages and in the labs who provided the critical initial support to stop the outbreak. Once again, we have repurposed our polio workers around the world, especially in Africa, to assist with COVID-19 response. In Nigeria, Pakistan, and Afghanistan, where polio personnel and assets have a significant footprint, workers from all of the GPEI partners are pitching in with COVID-19 surveillance, health worker training, contact tracing, risk communications, and much more. The U.S. Centers for Disease Control and Prevention, a core GPEI partner, has deployed their Stop Transmission of Polio program, known as Just Stop. These volunteers are already working on polio eradication in over 13 countries. They have now transitioned to COVID-19 preparations and response. In Pakistan, UNICEF is supporting polio community outreach networks. They're using innovative approaches such as WhatsApp messaging, motorbikes, rickshaws that are equipped with public announcement systems, and mosque announcements reaching over 1.2 million households. Also in Pakistan, our polio workers in the polio eradication campaign call centers are busier than ever. Islamabad reports phone calls up to 70,000 a day compared to their usual 4,000 daily calls. Instead of polio information, workers are primarily giving advice and information about COVID-19, dispelling myths and advising the population on how to protect themselves. Our surveillance teams are now in pursuit of signs of coronavirus, and active polio surveillance is a high priority. And these sites have helped to confirm over 1,000 COVID-19 cases in Pakistan, over 4,400 suspected cases, and nearly 500 probable cases. This combined surveillance for polio and COVID is ongoing in many countries across Africa and Asia. Polio surveillance staff have also trained and sensitized over 18,000 healthcare professionals. In Afghanistan, the polio surveillance network is fully involved in surveillance efforts for COVID-19. Over 45% of polio workers have been trained for COVID-19 response, as well as health professionals and community influencers. In Kandahar, which is a poliovirus epicenter, where the program has significant personnel, community social mobilizers have all stepped up in March. They're delivering something as simple as soap bars and information on COVID-19. Providing a bar of soap and demonstrating its use is a simple COVID-19 prevention measure and is very effective in Afghanistan's poorest and most vulnerable communities.
I hate to hang this up because I'll lose them. If that does.
We okay? The workers also taught physical distancing and the importance of staying home. And the soap packaging carried a pro-vaccine message reading, "Let's come together for a polio-free Afghanistan." In Nigeria, existing polio partnerships supported by UNICEF with the Northern Traditional Leaders Council and religious leaders are also being used to reach out to communities through social media, TV, radio, and announcements from mosques and churches. Also in Nigeria, there's a network of over 7,000 community health agents on polio and other diseases which have been leveraged. And now these health agents are educating families on preventative measures, as well as helping with early detection and reporting of suspected cases to WHO. Rotarians themselves are busy establishing hand washing stations throughout communities, teaching preventative measures. And Rotary has funded most of the surveillance activities in Africa the first quarter of this year. This activity is the first line of defense in many African villages and cities. I could go on, but suffice it to say that in several African and Asian countries, such as Niger, South Sudan, the Philippines, India, and more, the polio network is fighting COVID-19 while still preparing for future polio campaigns. All district designated fund allocations that are given to Polio Plus continue this vital work and are matched on a 5-to-1 basis by the World Fund and the Gates Foundation. No other use of DDF has such a match. So I'm urging your district today to contribute a portion of their DDF to Polio Plus. Our success in polio eradication will free up resources that will no longer have to be spent on this disease. And I'm suspecting that many of you may have been concerned at the increase of polio cases that was reported in Pakistan last year and into this first of this year. These occurred because the polio program there got off track briefly with a change in government leadership. The government briefly took its eye off polio. There was also polio fatigue being felt at households, where due to the low number of cases being reported, people didn't feel the urgency to have their children immunized, and the program became political. Polio workers were feeling a bit demoralized and not receiving the respect that they deserve from focal persons. In some ways, their citizens lost faith. But new appointments and changes at the federal and local government levels have turned these concerns around and put the program back on track. And the people now realize what will happen if the immunizations do not continue. All of their concerns have been addressed, and the government is more committed than ever to eradicating polio from Pakistan. Rotary and our partners continue to meet regularly with Muslim religious leaders to ensure that people understand the safety of the vaccine. And during this time of COVID, the Polio Communication Network has engaged 7,000 religious leaders and 26,000 local influencers at provincial, district, and local levels to promote social distancing and praying from home. Earlier this year, before the whole COVID-19 situation, Rotary leaders traveled to Pakistan as part of a Rotary delegation that included past RI President Ravi Ravindran, our chair-elect for the Rotary Foundation, our President-elect Holger Knack, and Michael McGovern, chair of Rotary's International Polio Plus Committee. It was unprecedented to have 3 leaders in these positions travel together to Pakistan, but all felt it necessary and extremely important. The trip was past President Ravi's idea. As the incoming chair of the Rotary Foundation, he, along with others, were concerned that the polio program seemed to be losing ground in Pakistan. Not only was there an increase in the number of polio cases earlier, but there was also an increase in the number of environmental samples testing positive for the wild polio virus, and it was evident that something needed to be done to reverse that lack of progress. This delegation met with the Prime Minister and with the head of the Pakistani Army, who in effect is also the chief of the whole Pakistani military. He is an extremely important part of leadership in Pakistan, serving in a capacity similar to the head of the Joint Chiefs of Staff here in the US. The meeting was highly successful, and they came away with renewed commitment from everyone they spoke with. And this story just gives you an idea of how Rotary is always working and advocating, often in the background, to get the job done. Another new development is a new oral polio vaccine that should be available this summer. Work is continuing, that has not stalled. This vaccine will start to reduce the incidence of vaccine-derived polio cases. It was Rotary. We should never forget this, that it was Rotary who first dreamed of a world without polio, and it was our insistence and resolve that led to, in 1988, the World Health Assembly adopting a resolution for the worldwide eradication of polio. It marked the launch of the Global Polio Eradication Initiative, known as the GPEI, spearheaded by national governments, CDC, Rotary International, the World Health Organization, and UNICEF. And later came the Bill and Melinda Gates Foundation, who have been a valuable asset, and most recently Gavi, the Vaccine Alliance, has become a partner. As the organization that first envisioned a polio-free world, Rotary has been at the center of the fight to eradicate polio for more than 3 decades. We should all be proud of the work that we've accomplished and Rotary's commitment to the pursuit of a polio-free world. Rotarians collectively have contributed over $2.1 billion and countless volunteer hours to the fight to end polio. Together with our partners, we continue to immunize over 400 million children every year. When Rotary formed its Polio Plus program in 1985, there were 1,000 children paralyzed by polio every single day in 125 polio endemic countries. Today, just 2 countries continue to report cases of wild polio virus. That's Afghanistan and Pakistan. We have made incredible progress, and we're optimistic that we will succeed in this effort. But eradicating a disease is hard work. And getting to zero cases requires sufficient funding, innovative strategies, perseverance, and the commitment of every single Rotary member. Because of Rotary, I am a proud active player in the eradication efforts, and I'm helping to make history. How powerful an idea, how powerful a story, the eradication of a human disease. What is the value of participating in the largest ever private public health initiative that has gained the support of 200 nations and the 5 powerful partners I just mentioned? That value is priceless. Our polio program has come so far, and there are challenges yet to face. But the Global Polio Eradication Initiative will remain the standard against all future multilateral public-private partnerships. It is the largest peacetime movement in history. And it's the second time ever that human dedication and ingenuity has brought the scourge of a disease to the brink of eradication. In a world, especially today, that's fraught with dissension and folly, our success shines, and it proves that we can work together across borders for the benefit of all. Our common future is at stake. Rotary's future is at stake, and we all have a role to play. Remember, the COVID-19 outbreak will create a setback in our polio program temporarily, and we will no doubt see a rise in cases when this pause in eradication efforts is over. But you need to know that extensive planning is ongoing now, and vaccination campaigns will be intensified and broad in our attempt to reach every child 5 and under, not only with polio drops, but in some of these campaigns will be including measles and other vaccinations at certain places, where we will no doubt see a resurgence of vaccine preventable diseases, especially throughout Africa and parts of Southeast Asia, and possibly even here in the United States. It is the children who once again will be affected, maybe not directly from the COVID-19 virus, but from all the other viruses lurking amongst an unvaccinated population. That, along with the rising food insecurity, children will suffer. As the GPEI has written in their most recent statement, and I quote, "In solidarity with the most vulnerable, the polio program will share its assets to ensure that this new epidemic is defeated as quickly as possible. Our commitment to polio eradication is firm. Our commitment to stand together against COVID-19 is now," unquote. Your contributions, your personal contributions, and those from your club are needed now more than ever. Every club is asked to contribute a minimum of $1,500 and to create awareness in your communities of what Rotary is doing. Don't ever forget that you and your clubs are the best public image voice for Rotary. Good stories make our history, and it is vital for generations of every age to learn of the disease that has shaped human history for centuries. Tell Rotary's story. Be the best Rotary polio advocate you can possibly be. Tell Rotary's story with COVID-19. Again, be the best advocate you can possibly be. And as the story of polio continues to be written, make sure that you are a part of it, whether it be through personal contributions, fundraising, advocacy, telling our story. You should be part of this history. You don't have to do what I do. Just have to do something. Rotarians do more than just make a difference. We actually raise the standards on humanity, the care and dignity of our fellow humans through our leadership, our generosity and kindness, but mostly through our compassion. Rotary does not see color or religion. We see people in need, and we offer a hand. I want to thank you all for making a huge difference and for helping people, especially in this need today, not just to live, but to thrive. Your continued support for our Rotary Foundation is nothing short of amazing. And every time that you make a contribution to Polio Plus, you are helping to make history, one child at a time, allowing a child to run, jump, and play. And As a person with polio, I remain committed to our cause, and I'm asking you to stay committed with me. Every step that I take is my reminder why we must eradicate polio. Every child you know, every child you see should be your reminder. As Albert Sabin, the creator of the oral polio vaccine, indicated, the true luster is to be found not in setting the goal, but in having the courage to take every step to achieve that goal. Please walk these final footsteps with me, because crossing that finish line is going to take continued wisdom, vision, and perseverance. And it's really going to take the heart of a Mrs. Woodbury to be there for that final step. Thank you for listening today.
Thank you, Ann Lee. That was awesome. I want to let you know that our district has traditionally given 20% of our DDF to the Polio Plus program.
Excellent. Thank you so much.
I'm sure that will continue, and that's to our due to the efforts of our esteemed District Polio Plus Chair, Willa Sutliff. He makes sure that we do that, and we are glad to do it.
Excellent.
So what questions are out there for Ann Lee? Remember to unmute.
I wanted to thank Ann Lee for all that she's done. I met her about 10 years ago, and I used her video in many, many clubs, which was based on the You Are the Wind Beneath My Wings. And it is one of the most emotional slideshows I've ever seen.
Thank you. I'm glad you, thank you. Thank you for sharing all of that.
Lauren?
Yes, Ann Lee. I'm curious, you may have said it, but I missed it. So I've always hung on the numbers. Forgive me, but I heard you talk about the uptick in Afghanistan because of the reasons you shared. What's going on in Pakistan, and do you have a current number as of today where we are with new victims?
You know, I don't have that number in front of me, Lauren, and I apologize. By the way, it's good to see you.
Likewise.
Both of those, I was actually talking more about Pakistan than Afghanistan when it came to the challenges and the rising number. It's Pakistan. But you know, I can look that up while we're talking and I will come back to you with that. How's that?
That'd be great. Yeah.
But go ahead if there's other questions. I can multitask sometimes.
Well, it was heart-wrenching, gut-wrenching to hear some time ago where some of the volunteers were actually murdered or slayed, and that was difficult. But are there going to be ongoing delivery or I forget how the phrase that we use to deliver the vaccines to these two countries by Rotarians who would like to volunteer, who would actually like to participate in dropping those drops, those magic drops in those little children's lives?
There will be, but not now. They're suspended the campaigns, as I said, because of the spread of the COVID. We, you know, traveling from house to house, we can't do that. But they will come back, and there will be campaigns that people can still participate in, absolutely. And as I said, the campaign is suspended, but routine immunization will still be available if parents are feeling safe going out to the health clinics. And the more that can do that, the better. But there is a, you know, right now they're encouraging people to stay at home. And so, but, you know, there's going to be birth. Babies are being born all the time. And hopefully they're going into the health centers to do this. And at which point those little babies will be immunized as well. So some immunization will still be ongoing. It's just that the broader reach will not happen until after the COVID-19 has settled down.
Yeah, can I inject something? This is me. Sorry, my IT guy didn't type in my last name. It's Bush. I'm Deb Bush from the Cherokee County Rotary. I'm a past president about 3 years ago. So I know Ina. I've met Ina. But I think the advantage of the polio program that we have is that the vaccine is so much safer than the first one that came out in '55. And you've benefited from the years of research in making it safer. The problem with the COVID diout is when they come up with a vaccine for that, it probably is not going to be the most optimal. It's going to take time. It's really going to take some time for us to be at a place where you can really count on that, you know, because COVID-19 is just acting so weird. It really is acting more like a rotavirus. And I think how we manage and grow vaccines around the world, whether it's a polio or whether it's the flu vaccine, because of the current problem with issues of pointing fingers at China, I don't think anybody deliberately released anything, but accidental is surely possible because of maybe how we're developing those baths. And I think we'll probably get smarter over time and we'll learn something from this, but it's going to take a while because politics has stuck its nose in there. And you know, that's so annoying when people just care about the numbers and what the information tells you, what the data tells you, and you just want to help people, you know, because there are a lot of power players involved in this that we have to maneuver around because some people have patents on certain things. And that is big money in our system. We just want to help people. And I think Rotarians overall are going to continue to do that because polio is a very core center of my belief as a Rotarian. I think it's one of the most important things that we do.
Well,
Yeah.
thank you. Thank you for all those comments. Polio is important. I mean, we can't put all this time and money spent over the last 30 years and throw it out the window. That would be ridiculous.
No.
And then have this disease come roaring back, which it would do. I mean, it's obvious it would do that. You'll see that at the end of the COVID outbreaks, you will see a rise in the numbers. And so as far as the vaccine development, we're still using the original vaccine. Vaccine is good. There's been many different oral vaccines that have come out so that we could target certain strains of the polio virus. And with that, we've been able to eradicate 2 strains. So we only have 1 strain of polio left to fight. And this new oral polio vaccine that will come out is even better. As you said, we learn, we can do better. We have all these scientists out there working on it. And now this one will stop, hopefully, that's the goal, the vaccine derived. What happens is that sometimes when you give the oral vaccine, it will mutate in a child and then it will start to spread. But remember, that only happens in a population of unvaccinated children. If everybody was vaccinated in a perfect world, we wouldn't even be talking about vaccine-derived cases because it just wouldn't happen. So, and I think that the coronavirus vaccine, most vaccines always take up to 18 months. I still think that it's going to take up to 18 months. There's a lot of trials that have to go on to make sure that this vaccine is safe. The worst thing that could happen is to have one that wasn't. And so there's a lot. And I agree, it shouldn't be a political football. It should be about public health. And public health means it should help everyone regardless of their amount of money they have or where they're from. It's public health. That's what we should be fighting for. And that's, I think, what Rotarians are fighting for. So now back to Lauren's question. 56 cases so far in 2020, 41 of them out of Pakistan. So that gives you an idea that Pakistan is our hotbed, and we're seeing lots of active polio virus picked up in the surveillance in the waters that we test for routinely. So the virus is still there. You're going to see a lot more of them, but we're going to come back fast and start vaccinating.
So Anne, just to clarify for all of us, what is we're visiting with people and selling this most notable international service, when we're down to 11 or 15 cases for the year, what would be, why would we be back to 56, do you think?
as I said, I talked about how the polio program got off track in Pakistan, and that's what happened. It became political football there. It's back on track. And again, there was another thing about compliance. You know, the cases went down. People started to feel comfortable. I don't need to vaccinate my child. There's only 8 cases this year. I don't need to bother. And the minute they stopped, the numbers came back up. And so that's what happens. And now they realize that if they don't vaccinate, if they don't continue, those numbers are going to rise even worse, regardless of COVID-19.
So that's a good phrase to end it with as it relates to, as it relates to COVID-19, because they're saying the same thing as you just said about polio. Yes, thank you.
And Lee, there's one thing that I would like to mention, and that is that the anti-vaxxers in the United States, in Europe, in Pakistan, in Afghanistan are very, very active. And this hit the web with worries. And even in Pakistan, people see what's on the web. And there was lots of misinformation that was put out on the web by the anti-vaxxers. I think the take-home message I would like to say for us is talk to your Rotary clubs about anti-vaxxers and the fact that these people are not operating on science, that they're operating on just politics, and that this movement has to be stopped if we're going to eliminate polio from the world.
This movement has to be stopped if we're going to protect our children.
Yes.
I mean, we're starting to see measles outbreaks in the United States. There's absolutely no need for that. Absolutely none. And so if they're all going to come back if we don't pay attention. And you're right. The anti-vaxxers have somehow got their hand on the COVID-19 situation, and they're fighting the vaccine. It's just, it's crazy. Thank you for bringing that up.
That's a new term for me, anti-vaxxers. I haven't heard that before.
Oh yeah, they're a huge group. I've done a lot of lobbying right here in my own state to get a law passed that children have to be vaccinated before they go to school. Let me tell you, it's a fight. Yeah, yep. It's a huge movement. It's scary.
Other questions?
Just a comment since most of us are from the South Dakota area or Northwest Iowa. When you're talking with people in these vaccinations, you can simply refer to the ranchers and ask them if they believe in vaccinating their calves when they bring them in from the pastures each year.
Yeah.
This is not new science, and actually most of our population here in South Dakota really depend on vaccinations for our food supply.
That's an excellent point. Thank you for bringing that up. It's an excellent point. And you know, just to prove that, in the northern part of Africa, where there's a nomadic group that goes back and forth all the time with their cattle and sheep, and you know how we reached them with the polio vaccine is we offered to vaccinate their cattle, and so they said, "Sure, come on in," and they've been very open to vaccinations ever since. So that's a very good point. Thank you. My husband's a veterinarian, by the way, so I noticed your DVM right off. Any other questions?
Larry, you put your hand up.
I have a comment. There was a hotly contested bill in the legislature in South Dakota this past session about removing the requirement for vaccinating school children. And some of our Rotary members were very involved in that movement. And it's amazing how soon we forget. I've had people tell me that polio was eradicated in 1955. We don't have to worry about it anymore. Things like that.
I wish.
Yeah, don't we all?
Yeah.
So we just need to stay on the message.
Well, Minnesota had a case of, they called it pseudopolio. Do you remember from 2019? Was it 19 or 18? But they called it pseudopolio. And I'm like, well, what's the difference between polio and pseudopolio? I remember seeing a news clip of the child at home with the mom, and it was a young one, but it was in a child that had not been vaccinated, is what I understood. And so that, I don't know any more about that because I don't live up there. I have family up there, but they aren't, you know, they weren't tracking it. And I wondered, does anybody have any information about these little cases that pop up? Are they in the,
They are not polio. The pseudo polio is actually, they think, a Coxsackie virus, which acts like
Okay.
it's related very closely to polio, but it is separate. And it causes some syndrome that looks just like polio in terms of the paralysis.
okay,
Yeah.
And it's not related to not being vaccinated because we don't
Okay.
have any vaccines against the Coxsackie infections.
That's true.
Mhm.
California had a bit of an outbreak with that too.
oh yes, I remember that. And I'm like, so this is a part of the public information issue that we have because everybody can pick up something. Just like I picked this up in Minnesota, but I didn't have access, you know, to how to track it down.
Yeah.
You know, I've got experience working in a infectious disease clinic outpatient, and that's why I'm kind of interested in the whole process and the microbiology and how things evolve. But the public image message, we were, you know, if this had happened in 1970, it'd be a different picture. So how do we have to still reach people? We have to tell them what we know to be the truth, and I think most Rotarians, until you'd made the statement, I thought Rotarians couldn't be fooled, but okay. We're human beings. Oh my gosh, we're not, you know, yeah, it's fun to be an angel, but we are human beings.
Yeah, with that, we're at the end of our time together. I want to again thank Ann Lee for presenting to us. This session has been recorded and will be on our website, so it would make a really good program for your Zoom meetings, your club Zoom meetings. You can cut out the before and after and just show Ann Lee, which would be wonderful. That she's I'm continued to be impressed with you, Ann Lee. It's been too long since we've met in person.
Thank you. Yeah, I missed
Yeah. I do want to remind you that we are going to monthly. This is our first monthly district all program meeting. The next meeting will be June 2nd, and that will be the end of our all district program meetings. And the whole purpose of our meetings was to help people stay connected to Rotary, to practice on our Zoom skills, and to bring some exciting speakers like Ann Lee to us here in the Heartland. So next month, June 6th, we'll have Carmen Hansen, our own district development chairperson, and Diane Edwards, our zone membership resource person. And they will be speaking on how to keep clubs together and develop and build your club during these trying times. So with that, thank you very much. Go forth and do good.
Thanks for
Thank you,
having me.
Ann Lee.
Thank you.
Thanks, everyone.
Everybody.
Thank you.